Hi, I'm Shelby Brantley, plastic surgeon with a particular interest in aesthetic breast surgery. Thanks for your interest in my practice as you research breast augmentation. Something that should be so simple can seem so complicated as you may be overwhelmed with a multitude of choices associated with breast augmentation. Gels versus saline, texture versus smooth, round versus anatomic, size, profile, where to make the incision, under the muscle, over the muscle. That's the reason I wrote Breast Augmentation, Navigating the Quandary. It's available for your review on my webpage. I think it answers a significant number of those questions. Millions of women have chosen to have breast augmentation. Reasons vary, but in essence it's about appearance in clothes, being able to buy a bathing suit top that matches your bottom, or for a boost in self-confidence. The end result's usually the same: a happy patient. How does one get started? Talking to friends, reviewing before and after pictures from the internet, and ultimately a consultation with a surgeon of your choice. How do you pick the right surgeon? I think that's very important. There are a few simple rules to be followed, and you can join the millions of other satisfied women who've had breast augmentation. Board certification by the American Board of Plastic Surgery is extremely important. It signifies proper training and credentialing so as to minimize your risk. Experience also is of paramount importance. It should be an operation that your surgeon performs on a regular basis and is extremely comfortable performing. Experience will allow him to get it right the first time. It reduces the instance of complication and helps in choosing the implant that will provide you with the best breast aesthetics. One of the biggest voice concerns I hear is related to size. Everyone wants to get their money's worth, but very few people want to look overdone or unnatural. That is why I can help you choose the implant that is exactly right for you. The decision would be based on the width of your breasts, the amount of glandular tissues you have, and the quality of your skin. During the operative procedure itself, I use sizers to meticulously assess the implant so that the right one will be chosen for you. That implant is then opened sterilely and handled in a gentle fashion. This will significantly reduce the incidence of complications long term, such as deflation, scar tissue forming around the implant. Another common question that I get is whether to use saline versus gel. Gel implants are more expensive than saline and do require follow-up MRIs to detect rupture. However, they are safe, and they are the ideal implant in thin women with very little breast tissue, or in women who have rippling associated with previously placed saline implants. Personally, I operate the Plastic Surgery Center in Mississippi by choice. And the reason is it's the only center in our state that's dedicated solely to plastic surgery. We know how to pamper you. Your privacy is of the utmost importance to us. Our anesthesiologists and nursing anesthetists know the right combination of drugs to prevent you from having nausea and allow for the quickest recovery. We use local anesthetic at the end of the procedure to block the nerves in the breast region so that after the procedure you have minimal pain. We use muscle relaxants and anti-inflammatories preoperatively, again, to try to make you pain-free after the procedure. Follow-up calls from me, from my office nurses, and from the nurses from the Plastic Surgery Center are the norm and to be expected. We're available 24 hours a day, 7 days a week, should a problem arise. A weekend is sufficient recovery time for most patients. One can resume exercising in 7 to 10 days after the procedure. Again, thanks for considering me. I have 3 assistants who are well versed in plastic surgery and breast augmentation. They're Susan Presley, Chanel Donaway, and Shannon Mobley. They're available to answer your questions either via email or the telephone, and they can give you an exact price for the procedure. Financing options are available, and I hope to see you soon.